Why are we revisiting a measure which was so universally denounced and despised? Well, there's been a new amendment that's been offered in an attempt to, again, within the confines of the Republican majority, to try and win votes to pass this bill this week. Again, they have a majority with roughly about 240 seats. They need only 216, and that's really what has been the focus of the majority leader in terms of trying to line up a vote this week. The amendment, the so-called MacArthur Amendment, again, revisits some of the issues which, again, some of the more conservative members of the Freedom Caucus were complaining about. And what it proposes to do is basically give states the ability to wipe out essential health benefits. In other words, the basic patient protections that were built into the health insurance law 8 years ago, and does nothing, again, in terms of trying to ameliorate the impact of the Medicaid cuts. That's the program for low-income and working Americans, which the ACA expanded and has done great work in terms of reducing the ranks of the uninsured. And that is the measure which we now have before us this week. Well, once again, the stakeholders who have to live with this have weighed in with their thoughts. And this is what the American Hospital Association said. The amendment proposed this week would dramatically worsen the bill. Again, a bill that was, again, so unpopular and poorly drafted and not ready for prime time, the Speaker pulled it from a vote on March 24th. The American Hospital Association, which is the largest trade association for hospitals in America, they represent thousands of hospitals, have said that, in fact, this makes it even worse, because by weakening the essential health benefits, and I come from Connecticut, we know a little bit about insurance in that state. What we know is that if insurance companies can redesign health care plans, the essential health benefits will be the ones that will be the first to go will be maternity care, behavioral health, and emergency coverage, because those are the most expensive items that are included within a health insurance plan. I would say, well, that's true. On the other hand, those are the essential benefits that families need. If you look at what happened since the Affordable Care Act passed in 2007 to infant mortality, for example, because of the Medicaid coverage, 50% of the live births in America are now women who, and particularly young women, who get the benefit of Medicaid coverage. So they get prenatal care. They get the help that they need to make sure that a healthy delivery occurs. And that's why infant mortality rates have been coming down in this country since the Affordable Care Act passed. To allow states to eliminate or give insurance companies the ability to eliminate maternity care, again, it's just going exactly in the opposite direction of a goal that I think all Americans support, which is to reduce infant mortality and to promote healthy live births.